For those who follow the science, it is leading them away from the chemical and surgical experimentation that is being done on minors under the deceptive title of gender-affirming care. In fact, the United Kingdom, France, Finland, Norway, Australia, and Sweden, none of which are strongly conservative nations, have all stepped back from the transgender craze. And 18 states here in the U.S. have done the same. Joining me now to discuss this is Dr. Jennifer Bauwens, the director of the Center for Family Studies here at the Family Research Council. She also testified before several state legislatures in support of legislation that would protect children by ensuring they are not rushed into irreversible and lifelong damaging gender transition procedures. Dr. Bauwens, welcome back to Washington Watch. Always great to see you.
It's good to be back with you, Tony.
Now, earlier this year, Norway announced that they were stepping away from this issue of embracing transgender surgeries and chemical treatments for children. Why?
Right. Like you said, it's encouraging to hear about people following the science. One of the things that they said was we can no longer call this evidence-based care. And then two, they said there's this curious trend about young women who are suddenly identifying as transgender after puberty. And, this isn't new for those of us who've been following this or, testifying on this. These are the things that we've been raising for some time. So it's nice to actually see people who are doing scientific reviews say the same thing.
So it raises a question when we see these European countries that I listed, in countries that are not known as being bastions of conservatism, that they're stepping back from this at the same time that we have here in the United States. We have not only, the Biden administration, which is driven by political ideologues, but you've got medical associations here in the United States doing the same. Why?
Yeah, I think that a lot of these organizations and including our own government in the US, they are dependent on us trusting what the science tells us. So in other words, whatever they want to dictate to us, as long as they have a peer-reviewed publication that they can throw around with some kind of statistical significance, then that means then their point is proven. But I think what our listeners need to know is that when these organizations like the World Professional Organization or Association for Transgender Health, when they say, or the AMA, the American Medical Association, when they say that they're using evidence-based care, it's important to know what they mean by that. So when I used to teach evidence-based practice, one of the things that we were instructed to tell students is that one of the factors that we're going to look at is if we don't have good science, basically we use the best available science. So these organizations are supporting mutilation of children based on the idea of consensus. So they get in a room together, they all know each other, they're all doing the same work to promote transgender supposed health, and they vote on these practices. So then they turn around to the public and they say, well, we are using evidence-based care. And in the US, we take it a step further and say that the science is settled when, that can't stand for very long because you're going to start seeing things unravel. You're going to start seeing we're seeing people who have detransitioned come out and speak against the harms. So, when you operate off of that paradigm of well, we're all going to get together and, this is making a lot of money and it's fitting a certain agenda. And so we're going to say, yes, this is the best practice.
Now, but at the same time,
really,
are they not trying to kind of suppress legitimate research that's being done, trying to make sure that they're not challenged?
Absolutely. And this happens a lot, especially in the psychological fields where there's a huge lobby behind the research that, for one, it's not even that they have to suppress it. There's a whole system at play that keeps keeps a narrative or any kind of research out of the conversation that doesn't fit the normative narrative or the
Yeah.
accepted narrative. And this is a huge problem in the academy. It's a huge problem with the grants that are given from our government to these institutions. That just becomes a big loop, a big
Right.
feedback loop.
Well, unfortunately, we're out of time for today, but it would look to me that kind of an encouraging sign is that it's already unraveling. That's why you have all of these nations stepping back. You've had 18 states here, many of them just this year taking this step despite the media, despite the testimony of these so-called medical groups. So common sense right now seems to be winning out, at least for now. We'll continue to pray and work. Dr. Jennifer Bauwens, always great to see you. Thanks so much for joining us today.
Good to be with you, Tony.